week or so, try to work to getting that hand in your mouth.
Okay. That's a long ways.
It is, but it'll get there. Like I said, it's stiff now just because we made you be in that,
Now, the therapist, okay, came yesterday. Was it yesterday, Chris?
The home therapist came yesterday.
oh, okay, just to help
She
with.
came, yeah.
Yeah.
I was going to take all of them on the,
Yeah.
make sure the paperwork.
Okay.
And she is a very, she's a really very nice person, number one. And she would like a specific,
List of instructions for how to work mom's elbow, if at all. I mean, like, this woman doesn't seem to have a lot. I mean, this isn't one that we chose. The hospital just called us and has said, hey, this woman's coming from this organization down in the South Bay. So she stopped by and she just said that, you know, she's never really done elbow replacement work
That's,
before.
I don't want her working
Exactly.
on the elbow.
So
Yeah.
that's what she told us, right?
Yeah.
So we'll go pass that news on.
Yeah.
But anyways, I mean, I do think she brought up a good point, which is that, you know, hey, just what are the possible things that mom should be doing from a mobility standpoint or strengthening standpoint
That's
for
what
this
this
recovery?
prescription's for, but
Perfect.
then I want you to make an appointment for outpatient hand therapy.
Yeah, okay, outpatient hand therapy.
Yeah.
Okay.
have you worked with anybody down there? A hand therapist?
I'm trying to think if there's anybody that I know for sure.
We've got a lot of contacts, Mom. I mean, we'll get somebody.
But now, wait a minute,
No, I know, the doctor would be great to recommend us.
right,
But we'll
because
also-
we
yeah.
don't know any hand people.
Yep.
No, we have a wonderful, wonderful sports therapist,
Yeah.
physical therapist.
Yep.
He's wonderful, but he's so gentle, you know, and he's been treating me for many years for different things for my back, you know, but he's never done an elbow, see?
Right.
And so I need what you want me to go
So
to.
Dr. LaTonta, when you say make an appointment for outpatient hand therapy, does that mean at the hospital locally or what?
Depends on where we can find somebody in your area.
Oh, because outpatient could be any surgery center or what have you, right? Okay, good, thank you, yeah. I just wanted
Yeah,
to
it could be
clarify.
a private place
Good.
or. So this is your new elbow. I don't know if you got
Oh
to
my
see
gosh,
that
this
or
was
not.
just, you gotta explain that to Mom, yeah.
Okay,
So this is your new joint, and then this is cemented down inside the bone on both sides.
Okay.
And we took out that radial head that was just clunking around in there.
Where was the radial head, like right
It was-
around here?
it was in
Oh,
this-
it's- Yeah, oh, that's the radial head, okay, I'm sorry, yeah.
So
now,
that's,
is
Oh,
that,
so there's two bones, right, of the forearm?
there's three
yeah,
bones that make
okay.
up the elbow, the radius, the ulna, and the humerus. So
Gotcha.
this remakes the humeral part and the ulnar part.
okay.
Got
Now,
it.
doctor,
Mhm.
okay, see, Chris, where the, yeah, I wish I
Yeah,
could.
what do you need,
What do
Mom?
you,
Okay, see, let's see,
You wanna get up?
no, I just want you to see where the bone is missing. Now, is that'll fill in, doctor?
you mean where the radial head came out?
Yeah.
Here?
Oh, there?
It will or it won't, but it's not, doesn't really matter because with this, your elbow's very stable now.
Okay,
When you don't have an elbow implant, you need the radial head for stability.
oh,
But this is linked now. This is a hinge joint now, so it can't come apart, it can't move side to side.
Yeah,
It's
yeah,
hinged.
yeah.
Yeah, it's
Okay.
hinged, yeah.
okay,
Got it.
and what's holding that bone? Is that bone just kind of floating
Here?
around?
There's a lot of scar tissue, and then there's a ligament in here
Oh,
that
really?
travels the length of the forearm, and then this bone makes a joint here at the wrist too. So it's still got a lot of things that are attached to it.
Okay,
Hmm.
okay,
We
so-
used to, years ago, just take radial heads out when people broke them. We just take them out and throw them away.
Really?
Oh.
Wow.
We don't do that so much anymore because we've realized it's a kind of an important component of the elbow
Yeah.
if you have your own elbow. But if you have an elbow replacement like this, it's not that important.
Okay, okay, right.
Cool. No, the work is beautiful, doctor. That's unbelievable.
Chris, did you take the picture with the?
Did you get a picture?
I did, yeah, yeah, thank
This,
you, yeah.
the previous picture?
Oh, I've got all kinds of pictures, Ma,
Okay.
yeah.
Oh, of when it was out of joint? Did you want a picture of that too?
Yeah, do you have that?
That's when they were taking the
Let me
x-rays,
flip
yeah.
this once.
Thanks.
There you go.
Oh, there.
So you can
Oh,
see.
wait a minute, so this was the before?
This is the before.
Wow, I haven't seen these at all. Wow, I'm taking some video here so Dad can see this stuff, yeah. And so this is what the previous surgeon had put in?
Yeah, that was the radial head replacement, and then it became loose over time because the elbow was loose. And that's, you know,
Wow.
the thing is, when you have a really bad dislocation, sometimes it's not possible to stabilize the elbow. Especially in people that are older, because
Yeah.
the ligaments and things just aren't strong
Yeah,
anymore.
yeah,
So even
exactly.
repairing them, I mean, he repaired them, because I actually cut through some of the screws that he used to repair it
Did
with.
you?
So,
Wow, yeah, that's amazing, doctor.
but,
That's-
He
you know,
had
so,
drilled a hole
but-
in the
yeah, so
bone.
he did the right thing, it
Oh,
just didn't
really?
work.
Yeah, it didn't work,
It just didn't
yeah.
work.
Okay.
That, I mean, your work is just so special. I mean, congratulations. And we're so lucky that
Well, thank you.
you have been able to help my mom, so
Well, I'm
thank
glad
you.
she found her way up here.
Yeah, I mean, oh my gosh, it's, I work down the street at Second and Brandon, so,
Oh, okay.
you guys have such a facility. I've never been in this building. I drive by it every day going to work.
Oh,
and
yeah.
This is so special, man. Wow, it's great. So yeah, that's the whole outpatient hand therapist thing.
Here we go.
Now, is it a
Yeah,
hand
occupational.
therapist is different from a hand special doctor?
Yes, so a hand therapist is a physical therapist or an occupational therapist who's done additional training to work only with the arm.
Okay.
So El
Camino
Camino
Hospital,
Hospital,
yeah,
looks
they
like
have.
they have hand therapy.
Great.
Um,
Cool. Could be good, yeah.
Yeah, so right in Los Gatos.
Oh, hand therapy. Oh,
Yep.
that might be at Los Gatos Community, Mom.
What's the name of it?
It's El Camino
Well, it's
Hospital
all
Los
commu-
Gatos.
But that's
Yes,
that's
right.
that's the old Los Gatos
Right.
Community
Oh,
Hospital.
okay,
Yeah,
okay.
yeah, that's perfect.
And then let's see
Great,
if there's
thanks.
any other options here.
That one's perfect.
That one works?
Honestly, that's the
Okay.
closest to Mom and
Yes,
Dad, so
great.
that's great. Yeah,
Okay.
thank you.
Yeah,
Wow.
Sunnyvale would be not as close.
No, no, no.
So we
that's-
call directly to the hospital,
Yeah,
okay?
yeah. We just.
And,
I have the website. Well, I mean, we can find the website, no problem. So good.
so doctor, would you have any communication with who's gonna, when
I
I'm trying to get-
communicate through this prescription I'm gonna give you, but I'm
Cool.
always, happy to answer questions, okay?
That the card through,
Yes,
Sapasha.
yes, through Sapasa, absolutely.
Oh, so maybe it's sinking in now, Doctor. So sorry for all the questions,
Mhm.
but Mom's gonna have a cast put on today.
No, nothing.
Oh my gosh, we thought we were coming up here to have a cast put on.
No,
Nothing?
nothing. She starts moving now.
Oh, Mother, this is great.
Yeah,
This is great.
I don't have a brace on
Well-
or anything,
Nothing.
doctor.
you don't need anything.
Mother, see,
Oh, I
you're.
need a bubble.
Look at this,
Doctor,
Mom. This is a
I have
miracle.
changed my walking habits and my,
Oh my
I'm
gosh,
just
Dr.
like,
Latanza, you've just changed our whole perspective. I mean, my dad thought for sure he'd heard that we were coming up here for a cast.
No,
Oh my goodness, this is great. That's, and I was gonna say a hand therapist, maybe that means that only the hand can get worked on with the cast on.
No.
But, okay, so that's great. So the occupational hand therapist will know from your prescription, of course, all the detail they're supposed to work on, right?
Mhm.
And nothing more, of course, yeah. Yeah,
Right.
okay, thank you.
so I'll just ask for the best hand specialist there is down there.
Mm-hmm.
Yeah, hand therapy, Mom.
Hand therapist,
Hand
yeah.
therapy,
Therapist.
hand therapist, yeah. Yeah, so that's great. That is so cool.
Oh my God, I'm so lucky.
See, Mom? My gosh, I thought we were gonna be waiting here for a cast to be put
Well,
on and all that.
No, I didn't
That's
think doctor
great.
was gonna do that, but I thought that, now you wouldn't put like one of those, things, like a sleeve, doctor?
You don't need anything. We'll wrap this back up if you want, but you can leave this open to the air now and just get in the shower,
Really?
get wet. And we'll need to take the staples out next week unless the
Oh, we will,
therapist,
okay.
if the therapist is willing to take them out next week, that's
Oh,
fine.
wow.
If they don't do that service, then we'll
Okay.
need to have you back up
Okay.
here to take
Okay,
out the
okay.
staples.
Okay.
Great. That is amazing, Mom, this is unbelievable.
I'd rather have, I mean, if I can come up here and have you do it.
No, I'm happy to do that. I
I'll
just
bring
didn't
it.
know if you wanted to drive all the way back up.
Oh, yeah, we
Yes.
don't mind, we do it all
Okay.
the time, yeah,
I'll
yeah,
just
thanks.
do that off the their
Will
list.
be available to you at any,
And how often does a week is your prescription for, Doctor? Just curious.
This is for twice a week for
Yeah.
6 to 8 weeks.
For 6 to 8 weeks, okay,
Yeah.
got it, yeah, yeah, cool.
now, in 8 weeks, you think my hand will be up to my? Let me see.
Your hand better be to your mouth by the next time I see you.
Yeah. Really?
That's your goal.
That's
yeah.
awesome.
I know it
Wow.
sounds like a lot, but you're stiff right now because you were in that brace, in that splint holding you out
Mhm.
straight.
So,
Now that we're gonna let you bend,
right, okay, and I'll get, yeah, and I
We'll
will,
start working on that even before you see the therapist.
Yeah.
Okay.
I'm already, I feel like if I keep rubbing it, you know, everything will wake up in there and start to heal better.
Wow, that is amazing, and
I mean,
that is unbelievable. This thing, Doctor, how long has this device been available to use?
Not this version only for a couple of years, but
Right.
Total Elbows have been around now for about 15 years.
15, okay, yeah.
Not in wide use though until the last probably 8 or 10.
Oh, really?
Yeah.
Cool. Very cool. Okay.
And there's still only, I mean, in San Francisco, there's only 2 people that do total elbow replacement,
Really,
so,
really,
yeah.
yeah, wow, that's amazing. Cool.
and who's that?
Me
Dr.
and Jim
Latanza.
Kelly over at CTMC. He and I were actually residents together.
We're here.
CP.
Mhm.
What's-
At California Pacific Medical
Yeah.
Center.
Oh, Kelly?
Jim Kelly.
Jim Kelly,
Okay.
doesn't matter, you won't need him. Mother,
No, I don't need him, but I just, you know,
who
Sure.
cares? Uh-huh.
I just like to get, you know, when I left here last week, I just, yeah, I was so scared, oh.
This
You
is,
know?
I'm blown away because
Oh.
we've been telling everybody we're coming up here to put a cast on it.
Yeah,
This is
yeah.
great.
No,
Thank
we,
you.
I think I'm gonna blow everybody away.
Yeah.
we want it
But I
moving.
don't wanna blow anybody away until I get that arm up.
Okay, it'll come, it'll come.
Now,
So,
what about soaking it?
no soaking.
No soaking.
Until the incision's
just the shower.
completely healed, just the shower.
Nice warm water.
Warm water and soap.
And that makes it, now, what about taking a pain pill before?
Therapy?
Yeah,
That's fine. You shouldn't need it because we're not gonna be doing a lot of pushing and pulling. This is gentle therapy, okay?
Okay.
If anybody's pushing hard on this, you say, stop, I know Dr. Latanza didn't want that to
Yeah.
happen.
Okay.
Okay?
okay, and, like if it hurts?
Yeah, I mean, you'll have a little pain as if they're gonna just gently push on the elbow here, but it shouldn't be sharp pain at all. Just, should feel like a stretching muscle, okay?
Yeah. Oh, okay, that's not too strong.
That's not too bad, no.
And then, do I go like this?
Yeah, the straightening, I really want the gravity to do the straightening. I don't want you using that triceps muscle too much. That's the one we reattached, okay?
Okay,
So let gravity help it straighten, and then you actively bend it, okay?
okay,
So use your muscle to bend it, but let gravity
okay.
go straight, okay?
Got it.
Okay?
Oh,
And then the other thing is hold your arm here at the side, right up on your hip, and turn the palm up and turn the palm down. Up and down like that, you practice that too, okay?
oh, thank you, this finger works good now.
It didn't work before, that's
Well,
amazing. Yeah.
it was there,
Mm-hmm,
but it was restricted,
yeah,
you know? And there was a bubble there,
Mhm.
you know, I thought, well, maybe that was the tendon that
Mhm.
sprung down there,
yeah,
you know? But this.
Works fine now.
Yeah, when I came out of surgery. But you were right, I mean, if you just followed every direction and just be so careful,
mm-hmm.
you know? I mean,
My mom and dad said that you had walked in on their first appointment with you and you had already studied everything and you said this is a definite elbow replacement,
Yeah.
right?
Yeah,
Yeah, you
yeah,
called it perfectly. I mean, that's unbelievable
Oh.
because, I mean, mom seems to really be taking to it
oh,
well.
if
so-
Yeah.
Thank you.
I've learned my lesson now, boy. From now on, when any of us get hurt, we come directly to the best person here.
Yeah.
I think that's a good lesson to be
Yeah,
learned,
yeah,
yeah,
it is.
Because I have suffered tremendously.
yeah.
And I kept thinking, oh, maybe I'll get better, maybe.
Sure.
And
You don't know when you're in the middle of it, you don't really
No,
know what
no,
to do.
I don't wanna
Yeah,
hold you
yeah,
up, I know
exactly.
you're.
That's okay.
you're so busy.
It's all right.
But, okay, so I'm gonna do that. So I can take a pain, well, I mean,
Yeah.
by a pain pill, I mean like Advil.
Yeah, and you can take, one of the ones you have still from the hospital if you need it.
Yeah, but
And-
those are so strong.
They are strong.
Yeah.
Ice also helps, so,
Oh, ice?
and they usually use that in therapy, and if you're working it at
Yeah.
home a little bit, ice is good, because it makes it not quite as sore, okay?
Okay.
So mom should, I mean, we have a ton of ice pouches or whatever. She should just lay the arm against the ice bag.
Yeah,
right?
just with a towel or something
Yeah.
in between,
Okay, okay,
yeah.
okay.
Okay.
About 20 minutes at a time.
Got it.
20 minutes at
Yeah.
a time?
15, 20 minutes,
How many times a day?
3 times a day is good,
Okay,
all right?
okay,
So this is the prescription that the
Okay.
therapist needs. It tells them exactly what to do and what not to do,
okay.
okay? But I'm happy to talk to them if they need to speak with me, but
So she's coming this afternoon? Oh my, it's
I
no
don't don't really
today's
want,
Wednesday.
I don't really want that therapist working on your elbow.
Mom, we're not
okay?
having this woman come to the house
Yeah.
anymore.
If she's already said
She's a sweetheart,
she's
but-
never worked with
No,
total
we-
elbows before,
Yeah,
I
so there's
don't,
no need for her to come tomorrow.
no.
No, Mother, we're gonna cancel that this afternoon.
And then make an
I'll call her.
appointment at El Camino or, yeah.
Yeah,
But
plus
we'll
Gads
call
Community.
El
Yeah.
Camino tomorrow morning,
Yeah.
you
This
know.
afternoon we'll call
Or
him
this
for sure,
afternoon.
yeah.
Yeah.
And, okay, I think we got it all down, and if we have any questions, I'll call.
Call Sapasa, she'll give me a message and
Right.
we'll get it taken care of.
And then like next week for the staples, I
Mhm.
mean, it's easy for us to come up here. We'd rather just have you guys do
Oh,
it,
yeah.
so.
Yeah, just come back next Wednesday.
Wednesday.
Next
Yeah.
Wednesday at
Yeah.
1:45,
Well, we'll make the
or,
appointment.
Yeah,
whenever.
check out front.
Yeah, we'll look at your, are you gonna be in town though?
You know what? I'm not. I'm up at Shriners in Sacramento, doing kid surgery up there.
Alright, cool. Yeah.
So, but you can come see Erin and she'll take them out for you.
Oh, really? Good,
Okay,
okay,
yeah.
yeah, awesome.
Oh, doctor, so you go up there and volunteer?
I do, yeah.
Oh, children who have
They're born without,
maladies?
yeah, born without fingers or thumbs
Yeah.
or too many sometimes, not enough other times. I take care of kids with bad elbow trauma that need reconstruction of their elbow as well, so
Oh, my gosh.
I've been going
you
up there
have
for about
all
10
this.
years.
You, not just your experience and all your education, and to think that you help all of us who get lost. know?
Exactly, Mom, I mean, well,
Right.
that's what
I
Dr.
mean-
Latan's has been trained for, and she's a specialist.
That's why I'm
so,
here.
Yeah,
Yep.
so thank you, gosh.
Boy, when
this is
they, you know,
unbelievable.
my friends kept telling me I was at the wrong doctor, you know. But he was so nice to me, and the thing
He's a
is, he
good guy.
made this, yeah.
He's a
he
good
is.
guy and he did his best to try and make that work and it just didn't
didn't.
work. That's
And
all.
he read and read
Yeah.
and, you know, and I was a little skeptical, but I thought, well, okay, he has my best interest at heart,
Mhm.
and he was so sincere at, you know, he didn't have that ego that you put,
Yeah, well, we all have surgeries that don't come out
Yeah.
the way we want them to.
Yeah, yeah,
And sometimes the injury is just too devastating to try and put it back together, you know,
Right,
there's Humpty Dumpty.
Yeah.
So,
Hey, Dr. Latanza, not to interrupt you, but
Yeah.
is there a schedule or frequency of checkups Mom needs to have for this thing over the
yeah,
years
so,
with you?
yeah, so what's gonna happen now is next week the
Yeah.
staple's out, and then in 3 weeks, I wanna check on her just to see what her range of motion's like,
3
make
weeks,
sure
got it,
your
yeah.
triceps is doing okay.
Yeah,
And then, I probably won't see her for about 6 weeks after that.
okay,
And then, the first year, if she's doing okay at 6 weeks and she's
Mhm.
got her motion back, then I won't need to see her again for about 6 months.
okay.
And then I x-ray the elbow once a year, just to make sure everything looks okay, just a yearly checkup,
Yeah.
once we're past the first year.
Okay.
so,
So
gosh,
3 weeks.
3, 6, 6,
Yeah,
and then once a year.
Yep.
Right, okay, thanks, that's cool,
Mhm.
awesome.
so I can wash dishes and, I mean,
I don't want you lifting with this hand yet,
no,
okay?
no,
Nothing more than a toothbrush or a fork,
Okay.
okay? If it's heavier than that, you'll.
So she can fork herself,
Yeah.
feed herself with
Yeah.
a fork on that.
Oh,
Good.
yeah.
Once you can get it there.
Yeah,
Yeah.
You need a really long fork right now.
Yeah, exactly, doctor.
okay,
Wow.
doctor,
Give that to him at the front desk and they'll help you with the follow-up.
okay.
Okay?
Oh, God, come here. Oh. Oh, doctor,
It's okay, Mom.
thank you so much.
You're welcome. My pleasure.
It's been a rough ride for Mom.
Yeah,
Thank you
you're
so
welcome.
much.
Glad we could help you.
Okay, doctor.
All right.
Thank
We'll see you in a couple
Okay.
weeks.
That's
Okay.
amazing. Thank you so much.
You're
Appreciate
welcome.
it.
Nice to meet you.
Take care. Have a good week.
Okay.
Okay, Mom. Looking good. Amazing. That's
Oh,
amazing,
gosh.
huh? That's great, huh? Good job, Mom. You got a clean bill of health here, kid.
Oh, my gosh.
You got a clean bill of health. I mean,
Oh, Chris, I just really have to change my life.
yeah, Mom.
I really have to slow down
Yeah.
and
I'm-
stop thinking a million things at a
Well, you
time.
do, Mama. I mean, that's, you have to stop that. Yeah, and that's what, maybe you should go see my therapist in Saratoga. He's really good at this. I mean, he's super mellow, and he really teaches me, he taught me how to focus and not get excited about things,
Yeah.
and take one thing at a time. I mean, you should go see him.
Yeah.
It's $320 for the first session, but after that, it's $160.
Yeah.
But you have insurance maybe. But yeah, Mom, that's what I've been trying to talk to you
Okay.
about, right? I mean,
Oh, my.
that's why you had this